Hi guys, I'm Dr. Heidi Goodarzi. I'm a dermatologist and pediatric dermatologist, but more importantly, I'm mom of three and a coffee addict. And today I wanted to talk to you about one of the most common skin conditions we see in kids, warts. We've all seen them, we all know how they look, but maybe we didn't know that they're much more common in kids than they are in adults. Also, maybe you didn't know that they're caused by HPV virus. No, not that kind. A different strain of HPV virus. So they're called by a virus. They kind of get under the skin and grow, and for some reason our immune system is like, this is not too worrisome, so it doesn't fight it off. So in some people, they grow to be a wart, also known as verruca vulgaris, because, you know, we're doctors and we're fancy. So now that we know what they are, let's talk about how we go about treating them. There are many different ways to treat them, and the difficult part is that not one type of treatment is better than the other one. That's a question parents ask me all the time. They say, okay, you talked about a lot of treatment options. Which one is better? I don't know. It really depends on how your body or your child's body responds to the treatment, and probably many other factors that we don't understand. But some of the most common treatments we offer in the office is freezing the wart. That is the cold spray, the liquid nitrogen spray, also known as cryotherapy or cryosurgery if you want to be super fancy. There are medications that we apply to the wart and they kind of cause a blister. Interestingly enough, it's the juice of a blistering beetle. So if you're looking for like organic all natural treatment, that would be yours. We apply the medicine and then it causes blister. Basically, these are known as destructive treatments. We're trying to destroy the cell that harbors the virus, and then in that process the virus also goes away. We also have some immunotherapy, meaning that, as I said, our immune system is like, this virus isn't that harmful, so it doesn't really fight it. So what we do is that we inject something into the lesion, such as Candida, the yeast. It doesn't cause any infection, but it revs up the immune system to come and fight the wart. The other challenging part is that majority of these treatments require multiple treatments 1 month apart. So you're going to become friends with your dermatologist, and I like that I get to see the kids month after month. The other thing we do in the office sometimes is to pare the wart down, meaning that take a blade and kind of cut that skin that sits on it and makes it super thick off of the wart, so that any treatment we do gets to the actual wart better. So what happens if you don't treat the wart? Nothing. A lot of them go away on their own as our immune system learns how to get rid of them. Majority of them, more than half of them, go away in 2 years. But that's a long time, and they're viral, so they're contagious. So the child can give it to themselves in other places. The most unfortunate ones I see is that when they scratch the wart and then they scratch the mouth or the eyes or the face and then they get warts on the face. That's not good. Or they can give it to other people, siblings or parents or classmates or whatever. So a lot of parents opt to treat it. Now, what can you do at home to treat them before you go to a dermatologist? There's a lot of things you could do, and as a matter of fact, we recommend you do your home therapy in between sessions that you do treatment in the office. So what can you do at home? Number one is salicylic acid. There are so many compounds that contain salicylic acid. Most of them are 17% salicylic acid. Compound W, ward off, Mediplast. They come in forms of drops or tapes. That is the most common compound we use over the counter for warts. So you want to buy a salicylic acid compound. They come in forms of drops, tapes, and usually they're 17%, but sometimes you can get higher percentage. It's best to start with 17%. Ward off, compound W, Mediplast, there's just so many over the counters. So you buy that, and you buy duct tape. Yes, duct tape, not the ugly gray one. It's a child. So be kind, buy a colorful one, and then a nail file, ideally the ones that you can break. So what you do is that you soak the wart for 5 to 10 minutes at night or after shower when the wart is already kind of white and moist and stuff. Then you start kind of filing away at it. So take care of that dead skin as much as you can. Sometimes you see a little bit of pinpoint bleeding. That's okay, but try not to cause bleeding in your child. So then after that, you apply your salicylic acid, whether it's drops or tape. You put it on there. If it's drops, wait until it dries out and then put a piece of duct tape on it. If you're cutting your nail file into pieces, then just toss that. If you're not and using a whole thing, then make sure you only use it for this purpose. You don't want to use a virus infected nail file on your nails because you can get warts under your nails. So you put the salicylic acid, you wait for it dry if it's a drop. If it's a tape, then great. And then you cover it with duct tape. If you want to know why duct tape, message me. That's a story for another day. You cover it with duct tape and you leave it on overnight or even 24 hours. And then you repeat the process. Now, I'm a mom, you're a mom. Things get in the way, schedules get busy. You don't have to do this every night, even though I'll tell you to do it every night, as many times during the week as you can possibly do this. This would help the wart go away. Maybe you have to do it for 3 or 4 months. If you're already getting in-office treatments by me or another dermatologist, this helps the treatment go faster. So the wart will go away faster. So either way, whether you come in or don't come in, you have to do this. So there's no way around this. And then what if you do all of that and I do all the freezing and the drops and whatnot and it still doesn't go away? Well, we have a lot of tricks that we can do. Sometimes we order these compounded multiple medications in one cream for you to use at home instead of just salicylic acid. Sometimes we give you prescription medication like a very strong reddening to use at home. And then we have other immunotherapies that we can do in the office. So there are more things to do about them. The important thing is to know that not one treatment is better than the other, and you may have to try one 3 or 4 times, and if it's not working, try another one. So sometimes it's a long treatment and sometimes parents and kids get frustrated with it, but that's why you want to go to a nice pediatric dermatologist like me so you actually enjoy going in. Just kidding, all the dermatologists are amazing. And then last but not least, we do have an oral medication that we use for warts. It has to be under supervision of a physician, so no point about discussing it further here. Also, there are some laser treatments. And again, even though it sounds fancy, there's no better or worse treatment. It's just kind of trial and error. So that's the story of common warts. And then some warts are in challenging areas like on the face, in the groin. Do not use salicylic acid or any irritating compound on the face, on the groin, in the skin folds that will cause more damage. Those are the ones that you want to get a prescription medicine from your dermatologist to use on them. With that, I think I covered most of the things about warts. Let me know if you have any questions. Comment below, subscribe to my channel, whatever they do in this world, and tell me what topics you want to cover so that I can do another short video on those and save you a lot of trouble. Bye.